Right, so we can have the fourth speaker, Dr. Kiran BAIDYA. She'll be speaking on comparative study on efficacy of intravitreal brolucizumab versus aflibercept in diabetic macular edema.
So as we know, DME is defined as the accumulation of fluid in the intraretinal and subretinal layers of the retina. Aflibercept with molecular weight of 115 kilodaltons binds with VEGF-A, B and placental growth factor. Brolucizumab with molecular weight of 26 kilodaltons binds with VEGF-A and in a 2:1 ratio. The aim of my study was to compare the changes in visual acuity and central macular thickness after injection of aflibercept and brolucizumab in treatment-naive DME patients. Objectives were to study the change in visual acuity and central macular thickness and to study if either drug is superior to the other in terms of clinical or anatomical improvements. So it was a single-centered randomized prospective comparative study carried out in Department of Ophthalmology at B.R. Singh Hospital for 18 months in 124 eyes. Patients with diabetic retinopathy and macular edema with central macular thickness of 300 microns on OCT were included in the study. Patients with infections, intraocular inflammations, glaucoma, or having received prior intravitreal injections for retinal vascular or degenerative diseases were excluded. Baseline investigations were carried out and then they were followed up every 6 weeks up to 52 weeks. The study group was divided into Group A, which received aflibercept, and Group B, which received brolucizumab. They were given 5 initial loading doses at every 6 weekly intervals, after which at 30 weeks, a disease activity assessment was done. If there was increase in activity, then the injections were again given at 6 weekly intervals. If there was no increase in disease activity, the injections were now given at 12 weekly intervals. So again, at 52 weeks, disease activity assessment was done. We found that mean BCVA improved significantly in both groups, but there was no statistical difference. Also, mean CMT improved significantly in both groups with no statistical significance. But the percentage of patients with central macular thickness less than 280 microns in aflibercept group was 28% at 30 weeks and 43% at 52 weeks. And with brolucizumab, it was 47% at 30 weeks and 59% at 52 weeks. The percentage of patients without subretinal and intraretinal fluid with aflibercept was 17% at 30 weeks and 34% at 52 weeks. And with brolucizumab, it was 30% at 30 weeks and 48% at 52 weeks. There were no severe adverse reactions. So the Kingfisher study also concluded that there is no clinically meaningful difference in visual outcomes between brolucizumab and aflibercept, but brolucizumab was slightly superior to aflibercept in terms of reducing SRF and IRF. In this study also, we found that BCVA improved significantly, along with CMT also decreasing significantly in both groups. In aflibercept, 34% eyes and brolucizumab 48% eyes showed absence of SRF and IRF. Aflibercept showed 43% and brolucizumab showed 59% eyes with reduction of CMT less than 280 microns at 52 weeks. So in conclusion, the efficacy of brolucizumab and aflibercept were comparable in terms of both visual acuity improvement and CMT reduction in treatment-naive DME patients. But brolucizumab showed slightly higher results in SRF and IRF reduction. Thank you.
So in your study, brolucizumab is better molecule than that one?
Yes, in terms of anatomical, it is slightly better.
And clinically, as far as central macular thickness is concerned?
It is comparative to aflibercept.
And the cost-wise, price-wise?
So price-wise, brolucizumab would, for cost-effective, yes, for patients, yes.
So were they your patients paying patients or were they covered under insurance?
Oh, they were actually government employees, actually, central government employees.
Railway is providing the molecule.
How the patients were divided into two groups? Was the rationale, were they randomized or
It
just
was simple random sampling.
simple random
Yes, ma'am.
sample? Baseline characteristics, they were comparative or there was any difference in the thickness and all those
Yeah, so,
parameters because they have not been mentioned.
yeah, so
If
baseline investigations.
one of the group might be having less thickness. The other, those baseline parameters, were they compared?
Ha, ma'am. The baseline characteristics basically all patients above 300 micron CMT in both groups. They had more than 300 micron
One
CMT.
might be having 500, the other 600, the one 300.
Yeah, ma'am.
So baseline parameters,
Yeah, it
because
was.
you are young an ophthalmologist, before we start any study, the baseline parameters have to be compared before we proceed.
Okay, thank you.